Dr. Welchons, thank you so much for taking the time to speak with me today. So I just have a couple of questions to ask you about contract negotiations. So first thing I want to know is what do you think are two things that a candidate should have top of mind when thinking about negotiating a contract for employment?
I think one of the most important things that they need to assess is what are their long-term goals professionally, and what aspirations do they have first and foremost for that position or that job. And that's sort of, I think, one of the most important things to consider because your long-term goals need to meet up with the current job opportunity you're applying for. And secondly, I found, and I've done a lot of interviewing candidates, and I went on some interviews, and when I was looking for jobs, and one of the second most important thing is coming prepared, asking questions. When you are going for a job interview, there should be a lot of effort and time put into trying to figure out things about the practice or the hospital, trying to figure out what are the sort of the things that could be an issue for that employment, and then have a whole list of questions related to what you might be concerned about, so you can really get an idea of what if this job really fulfills the sort of needs you have in a position.
So what are some skills that you feel are essential in negotiating a contract coming out of fellowship?
I think some skills that are essential are sort of looking at, what are the sort of job, the parts of the job that is most important to you. We're not used to negotiating these contracts coming out of fellowship or coming out of residency. It's not always easy when you're going to a competitive market to get what you want out of your job, and so some of it has to be flexibility on your behalf of what you want to do. There's some places where there might be a saturation of oncology fellows, and so you have to sort of give yourself the best chances of succeeding, and you have to sort of look at what your chances are given the location you're in. I think a lot of that, the challenges can be related to location when you're looking for a job. If you live in a big city, there's a lot of applicants that might be trying to go to that city, which may make it more challenging for you. If you're going to a more rural setting, I think that you probably have a little bit more negotiating power in that market. So the market can really affect how much you can negotiate sometimes. I think for more rural settings, there's probably more wiggle room associated with contracts, whereas in some of the bigger markets, even when I was interviewing some of the bigger markets, there's not as much ability to change the contract or to change or for negotiating power might not be quite as good.
I'm hearing that residents and fellows aren't able to negotiate their contracts traditionally. So when would contract negotiation skills be best utilized? And do you think any aspect of this would change in the near future?
I think that the contract negotiation skills are best utilized when you're looking forward early on in your residency, early on the end of going towards the end of your residency is a good time to sort of use those skills. When you're looking at jobs, I think traditionally we have said that there's not a lot of negotiating powers, but nowadays, especially in the field of urology, I'm not entirely sure that's the case. There is people now that will go out there and go to LUGPA meetings for residents or AUA meetings and meet different attendings or residency directors or program directors of hospitals and get involved with these conferences, and you're able to really kind of make a connection. And if you make a connection early, I think that you have more chance to negotiate your contract, and potentially even when they can sign you on earlier, they're happy to sort of do that in such a way. So I think that, I think in general as a physician in residency, we're not necessarily taught these skills, but when you go out to some of these conferences, you can, one, gain some of these skills from going to different sort of conferences that they have. Even at LUGPA, you'll see every year they have things related to contract negotiation. I think there's definitely lots of things online that can help you. Obviously, there's a huge sector now with blogging related to physicians and medicine and economics that can help you sort of get the skills and might help you sort of get a leg up when it comes to negotiating. Although you might not be able to always negotiate your contract, it certainly doesn't hurt to understand the lingo, the jargon associated with these contracts, and that takes effort and time on behalf of the resident to sort of learn those things. So hopefully they can get the best outcome.
Interesting. So I kind of heard you talk a little bit about like building relationships early on. Do you believe trust plays a big role in contract negotiating? And this could be something that you can build upon even before or during the interview process?
I think trust plays a huge role when it comes to contract negotiating. In general, when you're looking at a job, when you're going to one of these practices or going to a hospital system, these people are looking for long-term partners. They're looking for long-term physicians that'll be with their organization for an extended period of time. And that's for both continuity of care for their patients and as well as for economic reasons. So there's not a constant changing of physicians. It's expensive to recruit physicians and it's expensive to start a new physician in a position. So I think that, negotiating is good, being honest with what your intentions are, and you'd hope that is important, and you'd hope that the employer is honest with what their intentions are. Being transparent is very important. Developing a rapport is important. All of these things are helpful because in general, if you're feeling as though you can't trust the organization or the group that you're interviewing with, I can't imagine that it's probably going to work out well for you once you join that, and vice versa. If the organization or the group gets the feeling that maybe you're not transparent or there's not a lot of trust, I'm not entirely sure, one, you'll get the best outcome as it relates to the negotiation, and two, there might not even be an offer on the table if there's not trust and transparency associated with it.
I see. So do you believe that, with this whole transparency that you're saying, that while in negotiations that a candidate should show that they're willing to walk away if, their most critical requests aren't met?
I think that's not a good way to approach these negotiations. I think that, again, you're looking to have long-term relationships with these organizations and groups. This is potentially a group that you could spend a decade or more with. These are people that you're going to look as colleagues, friends, trusted confidants associated with taking care of patients. I think that those types of demands right off the bat are not a good indication that you're a good partner, and it's probably going to be a red flag for groups if you take that approach. I think it's perfectly fine to let them know what you would like, and if it's important to you, let them know that it is important to you. But making demands and saying that if they're not met, you'll walk away is never going to be a good negotiating tactic.
So when talking about the contracts, is there a clause or something that's in contracts currently that you think candidates should be very knowledgeable about?
Well, I think there's a few that are important. I think that one in particular that might not always be thought of is intellectual property clauses associated with the contract. A lot of doctors and urologists especially, I find to be quite entrepreneurial. That's why there's a lot of, continue to be private practice physicians in this field. And I think that the intellectual property clause is something you might not think about when you're first applying for a job or in a job, or looking after residency, but you might find that when you get into that position, you have an interest in developing a new product of some sort, in doing research with drugs, or doing consulting work with drug companies. And I think that the intellectual property clause, although you might not think you're interested in doing things like that, I don't think it can be very good to have that in there to your benefit at first, because I think that's one of those things that an employer or even a group is willing to potentially modify for you in a mutually agreeable way, so that you don't find yourself down the road thinking you wish you had changed that.
So let's say, you've negotiated the contract, you're working and everything's going well. And as we know, things happen, life changes happen, you may need to take some time and, not work as much, or maybe you have a family now, or maybe you have ambitions to move into another position. Do you feel that negotiating a contract associated with like a salary change or a title change may have the chance of kind of negatively affecting a relationship with an employer? And why or why not?
I don't think so. I think it's all about the approach and how you go about doing something like that. If there is something that you want to change, I think most groups and most organizations are going to want to accommodate you if it's based on certain reasons. It could be even that you think you deserve more money. And I think that if you go into that sort of conversation with reasons why you deserve that, whether it be with you working hard, your RVUs, your receipts, I don't see a reason why that would sour a relationship. It's tough. When you're a resident, it can be uncomfortable to talk about money. It can be uncomfortable to talk about titles associated with your position. But in general, if you don't ask for things, you're not going to get them. And I think that if you go about it in a way that's courteous, and if you have information to back up your asks, I don't think it's going to sour a relationship at all. And so I think people should feel as though they can ask for things, and you might not get them, but you should feel as though you can ask for it and not think that it's going to sour your relationship or change how your employer thinks of you.
So what are some things that you feel shouldn't be said in a negotiation?
I think that, things that you need to be careful about is employers are looking for long-term partners. So I don't think that necessarily you need to tell them exactly that you're going to be there for 3 years or 5 years or 6 years. I think in general, if you're looking for a job, they're hoping that you're going to stay for a while. I don't think you necessarily need to broadcast exactly how long you're going to stay right off the bat. Although, if you are going to be a just short-term job, it might not be a bad idea to tell them that. But if you're really looking for a position with a group and it's going to be, you think long-term, there's no reason to maybe tell them it may or may not be a long-term position. If you think you're going to be there, then I think that you just don't necessarily give them a forecast of how many years you are going to stay. I think in general, I've seen some pitfalls where people will say, kind of not sure they're going to be there for a long time, and they mention that during interviews, and that can sometimes be, lead to apprehension on the side of the employer.
That's good to know. So when it's time to negotiate, we know candidates should do their homework. What should they be looking at specifically to prep for negotiating employment?
We kind of touched on this a little, but I think it's important to kind of get familiar with the wording of contracts. Legalese can be difficult to determine what things mean, how they're stated, and I think that it's not a bad idea to sort of get familiar with reading some contracts. It's certainly not a bad idea to have a lawyer review a contract with you and kind of go over any unfamiliar terms that you might not understand. It's important to ask for clarity, because as physicians, we're used to understanding all the medical terminology, but when it comes to the legal wording, we may just read over it, not fully understand it, but think that we understand it. So I think that it's important to really review those things, understand the sort of wording, and be able to ask questions that maybe you think are dumb questions, but we're not used to reading these documents all day long, and so it's probably it's important to become familiar with all the words.
All right, got it. So, speaking about you personally, how many times have you had the opportunity to negotiate a contract for employment, and how would you rate yourself, your skills?
So I've only had the opportunity to negotiate a contract for employment 3 times, but that was all when I was looking for a job, my first job, and I'm still at that same first job. So when I came out of residency, is when I went about my first sort of contract negotiations. I would rate my skills as mediocre at best at that time. I think I felt uncomfortable with talking about certain things such as money and time off, and it was just such an unfamiliar experience. We're used to applying for medical school and getting into medical school, and this is, you accept or you don't accept. We're used to, which is very unique, essentially being told where we're going to go move to and live for years. And so we're kind of used to being told what to do and doing that. And in this particular arena, there's options for us to talk about these things, ask for things, and it's just very unfamiliar, at least for myself it was. So I wasn't very good at it. I think that's why we're trying to do some of these programs to help people become more familiar with things so that hopefully their experiences might be a little better.
I think you're being hard on yourself. I mean, obviously your skills are really good. You're still at the same job. I obviously love you and probably give you whatever you ask for at this point. So do you have any negotiation techniques or tactics you'd like to share?
I think that when you're going to start receiving solicitations for opportunities, and as a urology resident, you will receive lots of them. I think it's important to ask whether people that are calling you or trying to set up things for you for jobs are an in-house recruiter or with a firm. An in-house recruiter is someone who's employed by an organization to help find physicians, and they are personally usually they're employed by a group, and so they have a very specific interest in getting people to join that practice. They want it for the organization. They want the organization to be better. Recruiters from outside firms might not have the personal ties that an in-house recruiter might have. In general, maybe they have tons of opportunities available and might not totally understand all the nuances of each opportunity. So I think it's important to ask that question right off the bat when you're starting to get people, soliciting you for positions.
So does being able to negotiate well help in other aspects of employment or finances? Has it helped you outside of work? And how?
I think that, these tactics and negotiating skills can certainly help you with other aspects of your life and your career. You see a lot of movement now towards this acronym called FIRE, where physicians are, reading this blog, whether it be White Coat Investor or the Darwinian Doctor, these websites that kind of go into how you can be financially savvy, be a physician that, can help prevent going through any financial issues in life. And I think that understanding these contracts, understanding business can all help with that. And so it's not that the skills you might learn for contract negotiation will just be for your contract and you'll never use them again. I think over and over again, you'll find that becoming familiar with the business terms, becoming familiar with talking about what your expectations are as far as financial and also time off can actually help in your own life and trying to figure out what's most important to you. So these skills, I think, are applicable as you go on in your career and certainly can help you find success both with your job and then also with your finances at home.
So does contract negotiation play a role, you think, in private equity partnerships and acquisitions? Have you heard anything about that? This brave new world we're in?
Yeah, I mean, I think that in general, contract negotiations are about identifying things that you want and then going about way of asking for them and going about them in a way that is hopefully going to give you the highest chance of success. With the role of private equity in urology, I think that it involves you asking for things that you want and asking questions that might enable you to extract information so as to sort of determine whether, private equity is the right thing for you. When you're looking for a job, you're trying to figure out, is this the right place for me? Is this the right job? Is this the right institution? Is this the right group? And I think that's the same thing for groups that are maybe going through this transition with discussing with private equity. Do you think private equity is going to help you attain the goals that you're looking to achieve? Will private equity enable you to get to where you want? And I think all of those contract negotiation skills you get when you're looking for a job are the same as when you're looking for a private equity partner. We did have to go through this process with private equity, and I think the most important question that I had, especially as a young physician, is do I think that this will help us? Do I think it'll make us become better physicians? Do I think it'll make us become more successful in the future?
So my last question for you, I'm told that you were awarded the Eurolift Center of Excellence, or maybe it said you are the Eurolift Center of Excellence. Can you just tell us a little bit about this amazing achievement?
There's plenty of physicians in the United States that have a Eurolift Center of Excellence. Essentially, it's just a designation by Eurolift that highlights doctors that are interested in the Eurolift system, that have completed a significant number of cases, and also have a real interest in following their patients, monitoring the data, trying to get better, going to conferences, just trying to improve the overall health and care of patients as it relates to BPH, and in particular using Eurolift systems. So I am not the Eurolift Center of Excellence. There's plenty of them in the U.S., and but it's a great program, and I think it really helps sort of monitor your progress, and it helps you keep track of how well you're doing, which enables you to get better over time.
Excellent. Well, that was wonderful. Thank you so much for speaking with me today.
Thanks, Summer.